it was a bit of a shock to see that people really thought. About 7 years ago, I said on Newsnight the NHS was the last bastion of communism. And I was never forgiven for that. And the people that don't forgive you are not the doctors, the professionals, the healthcare people. It's the management. They don't like criticism. And my point at the Conservative conference and the talk today was that the first thing to improve is about cancer services, how we can improve Britain's cancer service. The first thing you have to do is admit there's a problem. And that's what NHS England, the management here, will never do. They come out with very good crafted PR to imply there is no real problem, we're putting money on it, and it's all going to be solved very quickly. I think that is the issue. If you don't admit there's a problem, you can't move forward. And, there is a backlog for cancer. We all know it. There's a trouble getting to see your GP. There's a troubles getting scans and x-rays. So let's admit it and see what we can do about it. We did it so well for COVID, Mark. Yeah. I mean, we did it really with the vaccination program. On my mobile phone here, I've got all the batch numbers of my vaccines that I had. Now, what else? Where else in the NHS can you get any information on your phone? Almost nowhere. So that was a crime.
I've been looking into your attempted cancellation by this NHS supplier. And Karol, I understand that your great crime was to be critical of lockdowns. What is your appraisal of how lockdowns have impacted public health in this country? Were they worth it?
It's a huge impact on everything: heart disease, cancer, stroke. I mean, the one I know most about, obviously, is cancer, because I'm an oncologist. And when you look at it, the number of people that will die from cancer over the next 3 years because of spread of the cancer beyond the primary organ is going to be massive, much greater than COVID, for example, where the average age was 83. So I really think we have to take a change in policy. And what I don't like is the inquiry doesn't seem to be investigating this. It's trying to almost cover up what went wrong. So I've been branded as a heretic about the lockdown policy, but for cancer, I'm certainly right. And I suspect my cardiology friend, heart specialist friend, tells me for cardiology, it's the same. The number of deaths from heart attacks will be much greater over the last few years and for the next few years than it would have been without lockdown.
Well, look, I think you've been very courageous. You've also pointed out the realities of biological sex without being in any way transphobic, Karol. The government are now going to ban trans women in female hospital wards and will protect basic biological principles in science. About time?
Yeah, about time. I think there's no doubt that I think Steve Barclay made the announcement yesterday. There's no doubt that we've got to be logical about it. The ultimate, of course, is not to have mixed wards. So you just have single rooms, as you do in private hospitals. And the NHS is gradually getting there. It'll take another decade probably to get there completely. The reason for having these open plan wards when I was a medical student, where the nurses all sit round, they're called Nightingale wards, everybody's in rows, is because the nurses could see the patient from the end of the ward. Now we have all sorts of technology, electronic wearables, gizmos. Every orifice can have a gizmo in it. You can measure anything in real time, and it can be displayed on a computer at the end of the ward. You don't need to see the patients quite as you used to.
And may I congratulate you for your timely use of the word orifice. Karol, we'll catch up soon. Great to see you in such fine fettle. The brilliant oncologist, Professor Karol Sikora.